My mom had become a palliative care patient after a long and courageous battle with breast cancer. I was in medical school at the time, and my family was fortunate and blessed to be living in Manitoba, a province that has been a pioneer in palliative care. My mom had access to some of our country's best doctors and nurses through their home and hospital-based programs. During the last 4 months of her life, her doctors made daily home visits to ensure that she was dying comfortably. Palliative care provides emotional and physical support along with comfort to patients and their families during the final stage of their lives. And yet, it is these dying patients that WIN's government has chosen to neglect. Palliative care in Ontario is largely provided by family doctors. Several communities are no longer able to attract new family doctors because the ministry has declared them as not underserviced. St. Joseph's Health Centre Family Medicine Department right here in Toronto used to provide home and inpatient palliative services, but they have been forced to terminate their program, and due to chronically understaffed ward and the demand that has been overwhelming. In communities across the province, there is a wait list for palliative care house calls. Just in the community of Etobicoke Lakeshore alone this week, there are currently 3 patients dying at home. Dying at home without any access to a palliative care doctor. Dying at home without any management of their pain and suffering. The Canadian Medical Association has mandated end-of-life care as a national priority. And yet it is our province here in Ontario that is leaving these dying patients without the support that they need. Despite their wishes, patients are unable to choose to die at home under the care of their doctor. A patient shared with me recently that her husband, a palliative cancer patient, had died in the local ER because there was nowhere else for him to receive palliative care. These patients deserve to die with dignity and with respect. These patients are someone's mother, someone's father, and someone's child. They deserve to die as my mother did, surrounded by their loved ones, knowing that their doctors will be there to ensure that they die comfortably. Why is the Liberal government turning their backs on some of the most vulnerable patients in our province? These unethical and immoral cuts must stop now.